Every year, about 2,500 men are diagnosed with prostate cancer in Uganda, and prostate cancer contributes 25% of the cancer deaths within the Uganda Cancer Institute. It is also important to note that these cancer rates are going up by a rate of about 5% every year. Prostate cancer is, like all cancers, is when the cells of the prostate gland begin to abnormally multiply and begin to invade surrounding tissues as well as tissues far away from the prostate. For many people out there, the question that would start is, what is the prostate gland? So the prostate gland is a small gland, not much bigger than this, that is located at the base of the urinary bladder in men, and it grows with time. And as we grow older, there is an increased risk that some of the cells within that gland will begin to abnormally divide, and in doing so, they will not only begin to divide abnormally and rapidly multiply, but will develop the ability to invade other tissues. And when this happens, a person will have developed prostate cancer. We don't have an exact cause for prostate cancer. However, we do know that there are several things that are strongly linked increased risk for prostate cancer. There are some which we can modify and others, unfortunately, that we cannot. The first one and the most obvious is age. So men who are above the age of 50 years have a significantly increased risk of developing prostate cancer. The other is men who have an unhealthy lifestyle. So an unhealthy lifestyle involves things like smoking, high alcohol consumption, and an unhealthy diet. An unhealthy diet is typically a diet that is rich in processed foods and sugars especially, and that has lower amounts of vegetables and other healthy foods and fruits and so on and so forth. There is also an increased risk of prostate cancer that might come from your genetics. Typically, if you are a black person, you have slightly increased risk compared to people of Asian descent. The other thing that is important to note is that there are certain genes, there are certain characteristics that are passed on genetically. So there are some abnormal genes that have been found to slightly increase the risk of prostate cancer within men. More recently, the one that people seem to enjoy talking about is that there is also an increased risk for people who have less ejaculations per month. Prostate cancer, like I described the prostate, it is at the base of the urinary bladder and it surrounds the urethra. That is the tube-like structure that leads urine out of the urethra, out of the bladder, and all the way out for a man who is passing urine. As that prostate, like I said, in prostate cancer, it grows abnormally without restriction. As it begins to grow, it may begin to press the urethra where urine passes. So some of the first signs that a man might experience might be difficulty passing urine. So you may find the strength of the stream that used to go half a meter is now only going a quarter of a meter. So there's a weakened urinary stream. The man may find himself having trouble completely emptying the bladder. Every time you pass urine, you feel that some urine is remaining. And so you keep going frequent times because you're never fully emptying your urinary bladder. You might also experience a sensation of fullness within the bladder because you're retaining that urine. You might also have signs of urinary tract infection because of the urine being retained. So things like pain during urination, discomfort when urinating, burning sensation, fevers in some cases. You might also have some blood in the urine at times. Importantly is that these symptoms tend to come gradually over time, so they tend to slowly keep worsening as the prostate also keeps getting larger. You might, however, also get signs that the cancer has spread from the prostate to other parts. Typically with prostate cancer, the first place it likes to spread is the lower backbone, what we call the lumbosacral region. So you might begin to experience severe back pain, okay? And that back pain might be accompanied by signs that the tumors that are spreading there are pressing on the spinal cord and affecting your ability to use your legs. So you might have severe back pain that might quickly progress into inability to walk, or weakness, or severe heaviness of the legs. To screen for prostate cancer is typically based on your age, okay, as well as your family history or risk factors, some of which I mentioned earlier. So if you're a man above 50 years and above, regardless of any history, you should begin screening. So we typically recommend screening by doing what they call a prostate-specific antigen test, a PSA test. It's a simple blood test that helps us to determine if there is any evidence that the prostate is rapidly growing. Now the PSA, I should add, is not a confirmatory test. It only helps us suggest that there might be some risk so that we can do further testing for you. So any man who is 50 and above should have a PSA test done once a year, and this should be looked at in terms of what the one of the year before was. If there is a sudden rise, usually above 50%, or if it is above the normal limit, it might suggest increased risk for prostate cancer, at which point you might be referred to do what they call a biopsy, where we take off a small piece of tissue from the prostate, and we have the pathologists, doctors who are specialized in examining cells for cancer, look at those tissues to ensure that there's no evidence of cancer. The other group, which may start slightly earlier than 50 years, if you have a first-degree relative who has prostate cancer. For example, if your grandfather, father, or your brother has had prostate cancer history, it would be good to start earlier, which is around the age of 45, and begin to do the screening by doing the PSA test. Yes, and once the PSA test shows any signs of elevation, usually we go ahead and do the biopsy. That being said, if you have any of the signs that we discussed, difficulty the passing urine, weak stream, you should quickly have an assessment done to make sure that it is not prostate cancer. To reduce your overall risk of prostate cancer requires a healthy lifestyle. So a healthy lifestyle typically involves having regular exercise that has been proven to reduce the risk for not just prostate cancer, but for many cancers across the board. Having a healthy diet. A healthy diet is one which is rich in antioxidants, rich in fruits, fiber, rich in whole grain, a lot of vegetables, a lot of healthy lean protein, and that is low in processed sugars and processed meats. The third one is to adapt other lifestyles that are healthy and avoiding the ones that are not. Typically, the one that most people obviously think of is smoking. Smoking has been associated with increased risk, not just for prostate cancer, but for many cancers. Okay, so if you're a smoker, this is a good time to consider quitting. If you don't smoke, this is a good time to be happy and not start. Alcohol use, the less, the better for most people. And then there are generally having good health seeking habits. So if you have signs, you go early and get checked. Frequent ejaculation has been associated with the reduced risk. So for the men out there, please continue to have a healthy relationship with your spouses. When it has spread, for example, to the backbone or to other organs, for example, the liver and so on and so forth. Now, once it has begun to spread, the treatments become a bit more aggressive because the disease itself is more aggressive. That can be done using one of two other modalities. The first one is we can do radiotherapy, where we expose these cancer cells to radiation that can kill them. It is a very useful way to manage prostate cancer when it has spread, for example, into the backbone, the lumbosacral region, the lower back. Then when it has also spread, sometimes we cannot identify every single spot, so we need medication that can work throughout the body, and that is when they may make a decision to initiate chemotherapy for select patients to help reduce the speed of the cancer growth. These all depend on the stage, but the earlier you are diagnosed, the easier it is to treat and the much better the outcomes. So again, it becomes very imperative to have good health-seeking habits and to do appropriate screening once you are of age.